Bismillahirrahmanirrahim. Assalamu alaikum. I am Professor Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel, Health Education. Dear viewers, we talked about what's fatty liver disease, how it develops, and its major causes in our previous video. Today, we shall continue this updated series and focus on a very important question. What are the symptoms of fatty liver disease? Because the understanding the signs early can help you prevent serious complications later. First of all, let's understand the silent nature of fatty liver disease. The first thing to understand is that fatty liver is often a silent condition, meaning it usually has no clear symptoms in its early stages. Most people feel perfectly fine. They only discover it accidentally during an ultrasound, blood test, or a routine checkup for something else. That's why doctors sometimes call it a silent liver disease. By the time symptoms appear, the liver has already started to suffer damage. So early awareness and regular checkups are key. The early warning signs in case of mild or non-specific symptoms. In the early phase, when fat is just starting to build up, people might notice very subtle or general symptoms such as unexplained fatigue, you feel tired or heavy all the time, even without hard work. The second early symptom is discomfort or dull pain in the upper right abdomen, just below your ribs, where the liver lies. The third symptom may be loss of appetite or feeling full quickly, because the liver's metabolism slows down. And the fourth symptom may be bloating or heaviness after meals, especially with fatty or fried foods. And the fifth symptom may be difficulty concentrating or mild brain fog due to toxin buildup when the liver isn't working efficiently. These symptoms are often ignored, are blamed on routine tiredness, acidity, or poor diet. But they can be early signs that liver is becoming fatty. The symptoms when the disease progresses, and these are the moderate to advanced symptoms. So as fatty liver progresses, inflammation may start. This stage is called non-alcoholic steatohepatitis, or nowadays it is called metabolic dysfunction associated steatohepatitis. Now the liver begins to get swollen and slightly damaged, and symptoms become more visible. And these symptoms are persistent fatigue, tiredness that does not go away even with rest, constant discomfort or pain on the right side of the abdomen, nausea or vomiting, loss of interest in food and unintentional weight loss, yellowing of eyes or skin jaundice. In some cases, if liver function worsens, and swelling of legs or abdomen in advanced cases. At this stage, the liver needs immediate medical attention because untreated NASH can slowly lead to fibrosis, cirrhosis, or even liver cancer. So the question comes, why symptoms are often misunderstood? One of the challenges with fatty liver disease is that its symptoms are non-specific. They resemble many other conditions, such as acidity, indigestion, vitamin deficiency, or simple fatigue. That's why relying only on how you feel can be misleading. Many people believe they are healthy until their tests show elevated liver enzymes or an ultrasound reveals fatty changes. So, if you have risk factors like obesity, diabetes, or high cholesterol, you should not wait for symptoms. You should get your liver checked regularly. So, dear viewers, in the next few videos, we shall talk about the complications, diagnosis, and treatment of fatty liver disease, including how to reverse it naturally through diet, exercise, and medical guidance. Remember, early awareness saves the liver. By recognizing these warning signs and tackling timely action, you can prevent long-term damage. So to summarize, fatty liver usually begins silently. Mild symptoms like fatigue, heaviness, or loss of appetite should not be ignored. If you have risk factors, check your liver before it's too late. So stay tuned for upcoming episodes where we will explore how fatty liver causes serious complications, how it's diagnosed, and how it can be treated effectively. If you found this video helpful, please like, share, and subscribe to my channel Health Education and help spread awareness for a healthier, informed community. See you in the next episode. Till then, take care. Khuda Hafiz.